Hi, I'm here with Dr. Godko. We're talking about sedation. I've got a lot of questions. I think it'll be good to ask all the different questions so the viewers can have their answers possibly answered about the different types of sedations. And going off the bat, what types of sedations are there?
That's a good question. So first of all, let's define what is a sedation. Sedation is a state of depressed consciousness. It does not mean you're at full sleep. It just means it gives you an effect of relaxation. There's different stages of sedation that dentistry can target. First would be a minimal sedation, which is provided typically by nitrous oxide or laughing gas. Then it would be minimum to moderate sedation, which is typically an oral sedation and IV sedation. And the last stage would be a deep sedation or sleep dentistry, which typically done through an IV with the help of general anesthesiologists, because we typically intubate people for that.
Okay, so I had the laughing gas, and it was great, but I'm a little anxious, and I get really anxious, and then especially when you have all the instruments in my mouth, I get like a gagging reflex. And so what kind of sedation is good for me?
For a person who does not relax well under nitrous oxide or feel like it's not enough, we typically would suggest to go either an oral sedation or an IV sedation route. Both oral and IV sedation can take the gag reflex out of the question, so you will be able to receive dentistry in a nice and comfortable setting.
Okay. So what is IV sedation?
IV sedation is basically we will have to set up a intravenous port through which we would push medications. And the beauty about the IV sedation is, besides the venipuncture part, is the medications take effect within 3 minutes.
Okay. So if I want to have the effect right away,
yes,
I would want to go with IV.
Yes, IV sedation is great for both short procedures as well as long procedures.
Okay.
It's a very well controlled environment because we can always push a bit more medications. The top dose, the maximum dose that we can administer is much, much higher than with an oral sedation. And the reversal agents, if something is going not the way we expected, kick in also within 2 to 3 minutes.
How long does sedation last for?
It depends on the procedures that we're trying to do and the basically art of sedating a patient. So to answer that, the IV sedation effect can last 15 to 20 minutes from one dose, but you may never feel like it lasts 15 to 20 minutes because we can push more IV sedation medication. So it depends on amount of time we need to be in dental chair and amount of dental work we need to accomplish that day.
So if I got a lot of dental work happening, I probably want to go with the IV, right?
It also depends. If you are very fearful of needles and you have severe needle phobia, I would suggest staying away from an IV sedation, because some people just, venipuncture is just so fearful experience. That's one of the indications we would go to oral sedation only. Second indication will be a long restorative procedure where it's not invasive. We don't have to do any surgical procedure. It's mostly restorative dentistry and maybe some crown work. Then I would consider doing an oral sedation as well. That's probably two main reasons to do an oral sedation over an IV sedation.
What are the side effects?
Well, side effects is number one is you cannot operate the vehicle for 24 hours after oral or IV sedation. And you cannot drive yourself to the appointment or drive yourself from the appointment. You need to have somebody with you. That's one side effect. Second side effect, you will not, I would say it's a bonus rather than side effect, but you will have amnesia typically of the day of the procedure. So you cannot plan to make any important life decisions for that day because you want
to buy cars.
Yeah, don't sign a lease, don't buy cars. Don't buy a house.
All right. All right. And is there like any like risk, why shouldn't I take sedation? I ask.
Well, yeah, we always try to sedate you to a state of moderate sedation, which is you're not at full sleep at all times. You are in and out of the sleep, even though you may not feel like you may feel like you slept through the appointment. It doesn't mean you will be sleeping through the appointment. It may just feel that way.
Gotcha.
Because that way we are do not need to control your airways. You can breathe on your own. If something, if you have liquid buildup in the back of your throat, you can cough. You have a cough response, which is a safety mechanism. So you can breathe on your own and you can cough. That's very important.
Okay.
Things when it comes.
So it's kind of more safer.
It's safe. It's much more safe than general anesthesia, which is like it basically would say deep sedation sleep dentistry.
Yeah.
State, because for that you do need to bring a second doctor, and it's typically anesthesiologist, because the drugs administered for that kind of sedation have come with many more side effects and potential risks, as well as we typically need to intubate patients and help them breathe.
Now, is everyone able to get sedation, or is there like...
Not everyone qualifies to get either oral or IV sedation. Common factors that disqualify patients would be pregnant, breastfeeding mothers, certain mental conditions, especially with declined memory. I would say also elderly and fragile patients may not qualify.
So like my mother, who's in her 90s, probably wouldn't do the sedation.
Yeah, probably will not be a best idea, because as we age, time it takes to clear the drug is longer. A and B, you may feel much greater effect as you age for the sedation, and it just may not be safe based on your health history and your medical if you have any medical conditions.
Okay.
So typically as we age, people get some health problems. They typically have some chronic problems, and sometimes by age like late 80s, 90s, some of the health of those people do decline a lot, and oftentimes it's not safe to do conscious sedation.
How do I prepare for the operation? Do I do certain things the night before?
Yes, it depends on your age and some other factors like your BMI, body mass index, whether you are a smoker or not smoker, and certain other factors. Are you a hyper-responder or hypo-responder? Have you ever had any type of sedation? So that's some of the critical factors that we look into in order to prepare you for a sedation experience. We may or may not administer medications to take an IV for, regardless if you're doing an oral sedation or an IV sedation. We may or may not provide you medications to take an hour before your dental appointment. And so that's kind of some of the factors. I would say it's very individual. So it's hard to answer just like generalized question like that, because it's very individualized question.
Okay, do all dentist offices offer oral and IV and the GATs?
No, not everyone, because you do need to have special permits and licenses to do that. We are duly licensed here. I am licensed in oral sedation as well as IV sedation with the state of New Jersey. So we can safely, rest assured, we received a lot of training, including myself, including some of the support team, which by state New Jersey has a lot of set parameters as well as requirements in order to get the permits.
So you're like one of the few in this area that...
Last time I checked, around the Mercer County, there's actually one more general dentist who can administer the IV sedation, but I'm not even sure if that's true because that was just based on the simple Google search.
All right.
Plus, I think we are the only one in the county of Mercer.
All right. Well, thank you very much, Doctor. I think you clarified a lot of the questions I had, and hopefully answered a lot of the questions that people out there would have about sedation dentistry. But thank you very much.